Good afternoon, and thank you all our mental health professionals and people in the community who could come out this afternoon to hear our presentation on African American men and untreated depression. We know this is definitely a mental health disparity, and we hope that this presentation will explain a little bit about why it exists and what we can do as a community to help reduce it or eliminate it. This slide shows a little bit about some statistics, and as you can see here, it says 26% of Black men who experience symptoms of depression are likely to seek help from a mental health professional compared to 45.4% of non-Hispanic white men. Black men who decide to seek help but would like a provider of the same race have difficulty in finding one since only 4% of psychologists are Black. An estimated 29% of Black males with depression go untreated. Only 1/3 of all Americans with a mental health disorder seek care, and half of that amount are African American. African American men between the ages of 15 and 24 years old are more likely to commit suicide than white non-Hispanic men. When African American men decide to seek treatment, they are less likely to be treated with medications, especially newer medications that have lesser side effects than whites. When they do receive medications, they often receive higher dosages, leading to more severe side effects. This slide represents disparity in prevalence. When living with depression, Black men experience symptoms that are far more disabling than white non-Hispanic men. This can cause absenteeism from work and school. When mental health disorders go untreated, African American men are more vulnerable to being incarcerated, experiencing homelessness, and substance use disorders. Working with homelessness, I've discovered that many of the African American men refuse to address their depression. The majority state they were brought up to be strong, and seeking help would show a sign of weakness. I've personally heard a few people just say that they're going through something right now, and once they're back into their own place, they'll be okay. I got the privilege to speak with one of the clients last night just to get an idea of where he's at and, kind of help with this project. And he stated that he went from being an LPN. Well, first, let me start with that. He grew up in church, a Black male. And as he got older, he discovered that he was gay. He kept getting rejected by the people around him, by the church. They, told him that what he was experiencing was a phase, that he would get over it, that he needed to, be normal. Those were some of the words that he used. And also that, he was even rejected by friends and family. And then as he got older, he became an LPN, very successful, had a nice apartment. And when COVID hit, there wasn't much that he could do other than isolate. He'd go to work and come home. He stopped opening up to people at work because he entrusted one lady that took everything that he confided in her and used it against him, which, he lost his trust in people. He stated that, when he used to feel down, he could walk around Walmart just so he could, be around people. But during COVID, that wasn't an option. So he tended to just go to work and come home. Well, eventually, symptoms of depression started manifesting and taking over. He couldn't get off the couch. He felt like he didn't want to move. He didn't want to shower. He didn't want to eat. And he tried to seek help, telehealth. That didn't help. He didn't feel connected. He sought help to some psychologists in person. He said he couldn't connect with them. He had a hard time explaining his symptoms. All he knew is that he just didn't want to move. They put him on some medication, he said, that didn't help. And eventually he lost his job and was evicted. He said when they moved him out, that it looked like a hoarder lived there. He couldn't even recognize that was his stuff and his belongings. He's now seems to be on a new journey. I discussed if he felt the willingness to seek help, and he admitted that he doesn't think that anyone can help him. We were able to direct him to some websites that are out there for African American men experiencing depression. And my hope for him is that he looks into it. This slide talks a little bit about individuals, families, and communities and how they can be affected by a loved one with untreated depression. So the person experiencing their depression and going untreated is not the only one who's being affected. It can trickle down to the families in their communities. And taxpayers can also be affected due to, like the previous slide said, um, many black men who go untreated can struggle with being incarcerated, experience homelessness, or even substance use disorder. And, as taxpayers, we pay for those who are incarcerated. I read an article the other day for an assignment that talked about prison being the new mental health facilities. And we know that it's difficult because they are not getting the appropriate help they need within the prison system. And if they're not getting the appropriate help they need for the underlying cause of their incarceration, they're going to continue this vicious cycle of being released and possibly committing more crimes and going back, whatever that looks like for that person. But we know that prison's not always the answer. Families tend to take on an emotional burden and worry for their loved one who goes untreated. Companies end up losing productivity for their employees who miss work, and in return, they lose money. So this is like, again, a vicious cycle. It goes far beyond the person who's experiencing it, and we all have a part to play in what we can do to reduce it. Causes and barriers of untreated depression among African American men. Racism and discrimination contributes to this mental health disparity. Several studies have linked depressive symptoms and other adverse mental health outcomes to experiences of discrimination. Specifically, research suggests that perceived discrimination, a psychosocial stressor, is a significant risk factor for the onset of depression among African Americans. This comes from an article titled Effects of Perceived Discrimination on Depressive Symptoms Among the Black Community. African American men tend to experience a higher level of discrimination than African American women, and therefore the onset of depression symptoms are more severe with them and more prevalent. Also, the second factor here is cultural mistrust of healthcare professionals. Um, there's a history going back from Henrietta Lacks, whose cells were abstracted without her knowledge and without her family's consent and sold to many, many, many science labs and medical facilities, and many experiments were done on these cells. These cells were even contributed to the polio vaccine. The cells were sent to space to see how space had effect on cells, and her family was never compensated. And it went on for years before a woman was took interest in it and ended up building a relationship with this family. Also, the Tuskegee studies is another one, where black men were brought into a clinic, and the research study was done on black men with untreated syphilis, and they went on for years untreated, even though a cure became available in the form of penicillin. They denied the men in their study the availability of the penicillin, stating that it could kill them or harm them even more, just so that they can continue their study with them. So, cultural mistrust in healthcare professionals goes on way back in history, and it's passed down from generation to generation. Another barrier is the lack of healthcare insurance, and that speaks for itself. Provider bias. So I got from an article, it says additionally, issues like systemic racism and the lack of cultural sensitive treatment by providers may also play a role in the way Black communities view mental illness and treatment. People often view it as a personal and or moral defect. As a result, the mental health field is viewed along the same lines as the other systems that have caused substantial harm to the Black community. So, provider biases is a huge barrier and cause for untreated depression. And those are kind of linked together with the racism and discrimination. I read in an article, the next one was misdiagnosis by healthcare professionals. A lot of times, depression in Black men is misdiagnosed as schizophrenia. And, it says the findings suggest that clinicians put more emphasis on psychotic than depressive symptoms in African Americans, which skews diagnoses towards schizophrenia, even when these patients show similar depressive and manic symptoms as white patients. And then of course stigma that ties into what we were talking about earlier. There's a stigma tied to depression. It's looked at as a character defect or something someone can just get over. A lot of times, African American men, like my one of our clients shared with me, is just get over it. It's something you're going through. Pull your big boy pants up. That's not the case. We need to do better with that as a community. So the major issues we'd like to address is one, the lack of healthcare insurance. Two, more education for healthcare professionals and cultural competence, educating Black men to reduce stigma and help the cultural mistrust of healthcare providers, and possibly building relationships between providers and patients. The lack of healthcare insurance goes back to, some of what African American men experience stems from, again, racism and discrimination. It's not a secret that African Americans are paid less than white non Hispanics, and by paying less, that puts them at a disadvantage for healthcare coverage. It's unaffordable. The answer for that is having a more and true universal healthcare insurance. Well, one of the answers anyway. Educating healthcare professionals in cultural competence, that needs to be an ongoing practice. And in the next slide, we'll discuss a little bit more about maybe how we can address that. Education always seems to reduce fear and stigma, but hopefully education can also help with the mistrust of the healthcare providers. And I think, that all stems to having more African American men who are role models who have experienced depression and what their depression treatment looks like, and to share these things with other Black men. Um, Building relationships between providers and patients. I know that may seem a little difficult, but if there's some way that we can bring more providers into the community to speak to the community, speak to African American men who are experiencing depression, build a rapport before they're even seen as a patient. Bringing them into the community to speak a little bit more about what depression is, what it looks like, how the symptoms may manifest, might make it a little bit easier for an African American man to seek treatment, or to help their willingness to see that they are cared for, that they do matter, and that they don't have to live with that, that seeking treatment doesn't mean that they would be spilling out all their, problems, and that they're not seen as weak. A comprehensive strategy would be to hold an event, ongoing events, maybe monthly, every other month, or quarterly. Have an event in which low-cost health insurance representatives, African American men who have a need to be insured, and other community members can find out more information about healthcare coverage for an affordable cost or even free. This event would include mental health care professionals who could come and speak about depression, what treatment may look like, what someone can expect in treatment. And by doing this, that would hopefully eliminate some of the fears that African American men may have about getting treated. Also help reduce some of the stigma involved. Education is key in that. I would like the event to include other African American men who have lived with depression and what their life looks like with treatment. Our stories have strength, and if they could come and share their story, that would also help reduce some of the stigma and hopefully help in eliminating this disparity. I'd like to hold the event in communities that have a higher risk of being untreated. Family members, the community, and anyone interested in education on this disparity would be invited. Also, another strategy I come up with for helping with provider bias is implementing CEUs, continuing education units, on cultural competence for healthcare providers. We can also offer that during these events, but if we make that a requirement for those who are involved in the mental health care of our African American men and women, if we make CEUs an ongoing requirement for those who are responsible for the care of this community, then maybe that can help eliminate the bias that is tied to mental health, and also help with like the misdiagnosis and things of that nature. The goal would be to make it a fun event so that kids could come as well. This event would educate, reduce stigma, and help with issues of trust. I also would like to build a phone app where one can find coping strategies to deal with their depression. Hopefully, we could also encourage more African Americans to train in psychology so that Black men may feel more comfortable with a professional of their own color, since that seems to be one of the issues that prevent Black men from seeking treatment. It's a barrier. They want someone of their race responsible for their care. And if we can help encourage more of the African American community to train in this field, to be educated in this field, then maybe we can help reduce some of that disparity. Hopefully you've enjoyed this presentation. I look forward to see what our community can do, what we can all do to help eliminate the disparity of African American men going untreated for their depression, just making them feel a little more comfortable about seeking treatment and eliminating the barriers of healthcare insurance, and with education and competence, cultural competence for the healthcare providers, and eliminating or helping with the mistrust of the cultural mistrust of healthcare providers. By doing all these things through these events, we would be able to help address the disparity and hopefully eventually eliminate it. Thank you for your time.